Imagine waking up with fewer nighttime bathroom trips, easier flow, and more confidence in the bedroom because you finally understand your prostate and how to treat it with respect. I am Ala Rain, a urology and pelvic health specialist, and today we're tackling a question I hear from American men over 50 every single week. Is prostate massage safe, and can it actually help? Let's set the stage. The prostate is a walnut-sized gland that sits just below the bladder and wraps around the urethra, the P-tube. You can feel it through the rectum. That matters because any touch to the area must be gentle, clean, and intentional. The rectal lining is delicate, it doesn't make its own lubrication, and the wrong approach can cause more harm than good. Safety first, always. Hygiene. Clean hands or a fresh nitrile glove. Trimmed nails only. Lubrication. Use a lube formulated for anal play. Rectal pH differs from vaginal pH. Generous application reduces friction and lowers the risk of small tears or bleeding. Go slow, think steady, light pressure, not deep tissue. Avoid if you have fever, chills, burning urination, severe pelvic pain, or a suspected infection. In those cases, see a doctor immediately. Big red flags: active bacterial prostatitis, significant hemorrhoids, rectal bleeding, unexplained weight loss, or known past suspected prostate cancer. Massage can worsen symptoms or complicate care. Why do people consider prostate massage at all? Historically, doctors used it for chronic prostatitis, pelvic pain, perineal discomfort, urinary symptoms, sometimes painful ejaculation. A small clinical study comparing antibiotics with and without scheduled massage found no extra benefit from massage for symptom relief. A broader look at prior studies also failed to show clear superiority. Translation for you: prostate massage is not a proven medical cure for prostatitis, but for some men it can still. Here's the nuance men over 50 need. While it's not a gold standard treatment for disease, some men report two meaningful upsides when massage is done correctly: temporary pelvic floor relaxation and sexual pleasure. The pelvic floor, the hammock of muscles between the pubic bone and tailbone, often becomes high-toned from years of stress, sitting, straining, and guarding against pain. Gentle internal or external work plus breath, posture, and hip mobility can help the area unclench and may ease pressure. Breathe down, not up. Inhale through the nose, let the belly expand, and picture the pelvic floor melting toward the chair. Exhale long and slow. Do 10 cycles before any exploration. Start outside first. Use a warm compress and gentle circular motions in the perineum, between scrotum and anus, for 2 to 3 minutes to encourage blood flow and reduce guarding. If you experiment internally, aim toward the belly button, anterior, 1 knuckle deep, slow and minimal. Think contact and weight, not poke and press. Time box it. 3 to 5 minutes is plenty. This is not a workout. Finish with movement. Stand, hinge the hips, do 10 slow body weight squats and 10 glute squeezes to rebalance tension. Sexual health angle. Many men find the prostate highly sensitive in a pleasurable way. Consent, especially with a partner, is non-negotiable. Communicate clearly, agree on a safe word, and prioritize comfort over intensity. If anything burns, stings, or feels sharp, stop. Pleasure should never require pain. Pro tips and lifestyle stack for men: 50 plus, hydration plus minerals, mild dehydration, thickens secretions and irritates the urinary tract. Target pale straw urine. Anti-sedentary rule: stand or walk 5 minutes every hour. Long sits compress the pelvic floor and irritate the perineum. Fiber up. Softer stools mean less straining. Less strain equals happier pelvic nerves and fewer hemorrhoid flares. Heat therapy. A 10-minute warm sitz bath relaxes the pelvic floor before bed. Strength where it counts. Combine gentle pelvic floor relaxation, down training, with hip extension work, bridges, glute squeezes. Overclenching Kegels without relaxation can backfire. If this is useful, hit like so more men your age actually see it. Drop a comment with your questions and consider subscribing. Around the 2,000 character mark, I want to give you something practical. Many men over 50 ask about safe, non-prescription ways to support vascular health and erectile performance. One evidence-informed pathway is to boost nitric oxide, NO, a signaling molecule your body uses to relax and widen blood vessels for better blood flow. If you're curious, check the first comment for a link to a nitric oxide support option formulated to provide dietary nitrates that your body converts to NO, supply amino acids that help maintain steady NO levels, include natural antioxidants that upregulate nitric oxide synthase, support mental clarity and everyday vascular wellness. Read the details, check the ingredients against your medications, and make the decision that fits your health plan. What to do if you're curious but cautious? Start with a clinician, a baseline PSA discussion, a symptom screen, and a focused exam rule out problems where massage is a bad idea. Try external first. Many men get 80% of the benefit from perineal heat, breath work, and gentle pressure without any internal touch. Use the 3 signals test. Proceed only if it feels warm, expansive, and pressure relieving. Stop if you feel sharpness, burning, or the urge to clench. Keep a symptom log for 2 weeks. Track urinary flow, nighttime trips, pelvic discomfort, 0-10, and sexual comfort. Small steady changes beat dramatic one-day fixes. Pair it with movement medicine, daily 20-minute walks, hip mobility, 90-90s, couch stretch, and 2 days a week of strength work will do more for your pelvis than any single gadget. What to avoid? Aggressive, repeated deep pressure. This irritates tissue and can flare hemorrhoids or cause bleeding. No lube heroics. The rectum makes zero lubrication. Always use plenty. Ignoring warning signs. Fever, chills, burning urination, or severe pelvic pain demand medical care, not DIY. Self-treating when you have known or suspected cancer. That's a hard stop until your oncology urology team clears you. A quick word on expectations. Prostate massage is not a miracle cure for chronic prostatitis or BPH, enlargement. In research, scheduled massage didn't outperform antibiotics for prostatitis symptoms. But in real life, some men report improved comfort and pleasure when it's one part of a broader plan. Sleep, movement, nutrition, stress control, pelvic floor balance, and smart cardiovascular support. Think small hinges swing big doors, gear and setup hacks, gloves bare hands. Besides hygiene, gloves reduce friction and improve control. Warm the lube container under water for 30 seconds. Comfort increases instantly. Use a folded towel under the hips to reduce lower back strain. Timer on. When it rings, you're done. Then walk and stretch. If you use a device, choose body-safe materials, a flared base, and rounded edges. Clean with unscented soap and warm water. Let air dry. Partner guide for couples. Talk first, touch second. Agree on lighter, stop, okay language. Start with external touch and breath syncing. Move internally only if both feel curious and calm. Before we wrap up, if this episode helped you or a man you love, please hit the like button and share it with a friend. Your share could spare someone months of confusion. And if you want more clear, stigma-free men's health guidance every week, subscribe and tap the bell. Community support matters. Becoming a channel member, sponsor, keeps these deep dive videos ad light and lets us make guides specifically for men 50 plus. If you found value today, join as a sponsor or send a thanks to power the next episode. It truly helps. Key takeaways for American men over 50. Safety leads. If there's any sign of infection or cancer, skip massage and see a clinician. Massage is not a cure, but it may relax a tight pelvic floor and add pleasure for some men. Lifestyle beats intensity. Hydration, fiber, walking, hips strong, stress low, sleep steady. Consider vascular support thoughtfully. Nitric oxide pathways are one promising non-drug route for blood flow health as you age. See the first comment. Most progress is boring before it's brilliant. Keep a simple log and give any change 2 weeks. Keep on. If you're still with me, leave a comment with the one tip you're going to try this week. I read as many as I can, and your question could shape a future video. And yes, subscribing helps the algorithm show this to more men 50 plus who need it. Disclaimer, please read. I am an AI urologist drawing on reputable publicly available sources. This content is educational only and not a substitute for personalized medical advice. Do not start, stop, or change any health practice based on this video without consulting your own urologist or primary care clinician, especially if you have chronic conditions or take prescription medications.